This morning I toured Gwanda Hospital, and I'm impressed by the work that is being done by the doctors and nurses around the hospital. It is very impressive. They have done a great job during this tight period under sanctions. We are glad that our people are conscious. They put conscience to make sure that they look after their own. But there are challenges that I've seen and positives. The positive thing is that there's improvement in terms of the availability of medicines in the hospital. There's some improvement. Equipment in the hospital, there's some improvement. Some of the machines that we've seen, the dialysis machines, they are new. They were delivered 2 years ago. But we need more dialysis machines because there's prevalence of prostate cancer among our people, and we have to increase the number of machines operating in the hospital. We also have seen positives in terms of the operations of the hospital. The staffing, the doctors that are actually deployed, there's some big improvement in terms of the number of doctors that are deployed. We've got specialists who have been doing operations here. Usually we used to take some of our patients to Bulawayo, but we are now doing the operation locally. So it's a great improvement under the second republic now. We are training, the numbers have gone up. We are replacing the depleted manpower that we've lost over the years. And we are now training more students and in-house training. We saw in-house training, which is to make sure that there is improvement in terms of skills by some of our nurses who have not done very well earlier on, but were in service. So it's very good. I think there's progress. The biggest challenge that we have is accommodation. And accommodation for both staff and the workspace. So we need to improve on that because we have got land that has been made available, but we need resources for us to start to construct a new hospital, a new Gwanda Provincial Hospital, to improve access to health by our people.
The issue of space it's real, particularly the issue of accommodation to our staff. I think we've made a tour to our staff quarters. You can see that the residence is very, very minimal in terms of the staff complement that we have at this institution. And it's one of the challenges that we are not able to accommodate as much doctors as we would want. I was telling the resident minister that currently we have 6 general medical officers against an establishment of 17. It's because of that accommodation issue. And we have the capacity to even accommodate more specialists. We have the capacity, the institution have the capacity to have more specialists here. But the challenge is we don't have space to accommodate them. So that's one of the challenges. Not only talking about that, in terms we can see the space that is within the institution is still now very constricted. I know there are plans underway to have a new hospital constructed outside this. A significant number of clients with chronic kidney disease and that are being followed up by our dialysis unit. The only challenge is the 2 machines are not enough to cater for the number of clients that need the dialysis. Thank God to Stanbic, I think 2 years ago donated us the other machine that we are using. But we would want, if there is a buy-in from the community, that we have maybe 2 or 3 other dialysis machines so that our clients receive dialysis when they need it. It's very difficult to queue patients for such a dire need in cases whereby there is a overqueuing of patients for for the dialysis service. So indeed, we really need we really need to increase the number of machines available, and the space is there in terms of the dialysis machines to have more machines.
Understood.